Today, we're talking about Lessina, a combination hormone medication used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. Apart from preventing pregnancy, this medication can also help make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using Lessina does not protect you or your partner against sexually transmitted diseases such as HIV, gonorrhea, and chlamydia. The recommended daily dosage and optimal timing for taking this medication may vary, so be sure to consult with your healthcare provider for personalized guidance. Before you start taking Lessina, make sure to read the patient information leaflet provided by your pharmacist. It contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. Choose a time of day that is easy for you to remember, and take your pill at the same time each day. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and swallow. It is important to follow the manufacturer's directions for your brand. Continue taking this medication exactly as prescribed by your doctor. With certain brands of birth control pills, the amount of estrogen and progestin in each active tablet will vary at different times in the cycle. It is very important to follow the package instructions to find the first tablet, start with the first tablet in the pack, and take them in the correct order. Do not skip any doses. If you experience vomiting or diarrhea, it can prevent your birth control pills from working well. In that case, you may need to use a backup birth control method, such as condoms, spermicide. Taking this medication after your evening meal or at bedtime may help if you have stomach upset or nausea with the medication. You may choose to take this medication at another time of day that is easier for you to remember, but it is important to take it at the same time each day, 24 hours apart. Your pill pack contains 21 pills with active medication, and may also contain 7 reminder pills with no medication. Take one active pill, with hormones, once daily for 21 days in a row. If you are using a product with 28 tablets, take an inactive pill once daily for 7 days in a row after you have taken the last active pill unless otherwise directed by your doctor. If you are using a product with 21 tablets, do not take any tablets for 7 days unless otherwise directed by your doctor. You should have your period during the 4th week of the cycle. After you have taken the last inactive tablet in the pack or gone 7 days without taking an active tablet, start a new pack the next day whether or not you have your period. If you do not get your period, consult your doctor. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. Consult your doctor or pharmacist if you have any questions about switching from other forms of hormonal birth control to this product. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. If you experience nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change, you may be experiencing side effects from taking Lessina. Additionally, you may also experience vaginal bleeding between periods, spotting, or missed/irregular periods, especially during the first few months of use. It's important to monitor these symptoms and contact your doctor if they persist or worsen. Lessina may also raise your blood pressure, so it's important to regularly check your blood pressure and inform your doctor if the results are high. Serious side effects to watch out for include lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing eyes/skin. In rare cases, Lessina may cause serious problems from blood clots, such as deep vein thrombosis, heart attack, pulmonary embolism, or stroke. If you experience symptoms such as chest/jaw/left arm pain, sudden dizziness/fainting, trouble speaking, or sudden shortness of breath, seek medical help immediately. It's also important to be aware of potential allergic reactions, such as rash, swelling, severe dizziness, or trouble breathing. If you notice any of these symptoms, seek medical help right away. And as always, if you notice any other effects not listed here, contact your doctor or pharmacist. If you are over 35 years old and smoke cigarettes, you should not use Lessina. Smoking can increase the risk of stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control. This risk becomes more serious as you age and smoke more cigarettes. It is important to not smoke or use tobacco while taking this medication. Before taking Lessina, it's important to inform your doctor or pharmacist if you have any allergies to estrogens or progestins, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to share your medical history, especially if you have a history of blood clots, high blood pressure, abnormal breast exams, cancer, high cholesterol, depression, diabetes, heart problems, kidney or liver disease, obesity, stroke, thyroid problems, or unexplained vaginal bleeding. If you have diabetes, Lessina may affect your blood sugar levels, so it's important to monitor your blood sugar regularly and inform your doctor of any changes. If you have diabetes or phenylketonuria, be cautious with chewable tablets that may contain sugar and/or aspartame. It's important to inform your doctor if you have upcoming surgery or if you will be confined to a bed or chair for a long time, as these conditions may increase your risk of blood clots. Lessina may also cause dark areas on your face and skin when exposed to sunlight, so it's important to limit sun exposure and use sunscreen when outdoors. If you wear contact lenses, you may experience vision problems, so it's important to contact your eye doctor if issues arise. It's important to note that it may take longer to become pregnant after stopping birth control pills, and Lessina should not be used during pregnancy. If you become pregnant or think you may be pregnant, it's important to contact your doctor immediately and discuss alternative forms of birth control. Lastly, Lessina may decrease breast milk production and pass into breast milk, so it's important to consult your doctor before breastfeeding while taking this medication. It's important to be aware that Lessina may interact with other medications, potentially affecting how well they work and increasing the risk of serious side effects. Some products that may interact with Lessina include aromatase inhibitors, fezolinetant, ospemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Additionally, there are some drugs that may cause hormonal birth control to be less effective, potentially leading to pregnancy. These include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs. If you start any new drug while taking Lessina, it's important to inform your doctor and discuss whether you should use additional reliable birth control. It's also important to let your doctor know if you experience any new spotting or breakthrough bleeding, as these may be signs that the birth control is not working effectively. Finally, be aware that Lessina may interfere with certain lab tests, potentially causing false results, so it's important to inform lab personnel and all your doctors that you are taking this medication. If someone has taken too much Lessina and experiences serious symptoms like passing out or difficulty breathing, it's important to seek emergency help. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe nausea, vomiting, and sudden or unusual vaginal bleeding. It's important not to share Lessina with others. Make sure to have regular physical exams with lab and/or medical tests while taking Lessina, such as blood pressure, breast exam, pelvic exam, and pap smear. Follow your doctor's instructions for examining your breasts, and report any lumps right away. It's important to keep all medical and lab appointments. If you need more details, consult your doctor. If you miss a dose of Lessina, refer to the package information for guidance. You may need to use additional birth control methods, such as condoms or spermicide, to avoid pregnancy. If you have any questions, consult your doctor or pharmacist. If you frequently forget to take your pills as directed, talk to your doctor about switching to a different form of birth control. Be sure to store Lessina at room temperature, away from light and moisture. It's important not to store it in the bathroom and to keep it out of the reach of children and pets. When it comes to getting rid of any unused or expired medication, be sure to not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to discard this product. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.